Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. I'm Brittany Schaefer. I'm joined by Dr. Celeste, and we're here today to talk about endometriosis. So my first question for you is, what is endometriosis?
Endometriosis is a disease that's actually mediated by estrogen that causes cells and tissue that typically line the uterus to be able to grow outside of the uterus inside the abdomen. It can be found in places typically like the lining of the pelvis, on the uterus, ovaries, fallopian tubes, and sometimes on other organs in the abdomen.
What are the symptoms of endometriosis?
There's actually a very broad spectrum of symptoms associated with endometriosis that can range from no symptoms at all to very mild pain with your periods. Sometimes women have chronic and severe pain, typically pain with things like emptying your bladder, moving your bowels, and some women can have associated infertility.
Who is at risk for developing endometriosis, and is it hereditary?
That's a great question. Although there's no actual hereditary link that's been clearly defined, it has been associated with women having higher rates of endometriosis if they have a first-degree relative, so their mom, a sibling that's been diagnosed.
Can a woman who has endometriosis get pregnant?
Yes, women with endometriosis can get pregnant, although some women have associated infertility. Most can get pregnant without any assistance, and in cases where people do have endometriosis-associated infertility, they can get pregnant with assisted fertility treatments.
How is endometriosis diagnosed?
The definitive way to diagnose endometriosis is through surgery, so laparoscopy and a biopsy of the tissue that looks abnormal. However, with a patient's constellation of symptoms, a physician is able to assume that they have a diagnosis of endometriosis and can start treatment.
How is endometriosis treated?
There's a broad range of treatment options for endometriosis. The first-line treatment agents are just your common NSAIDs or Motrin that help to inhibit something called prostaglandin and can treat the pain. Other treatment options are contraceptive agents, other hormones like progestins, and definitively can be treated with surgery.